everyone, and welcome to my pre and postnatal exercise ball routine. This is designed especially for the pelvic floor, alleviating a bit of lower back pain and also getting that mind-body connection with your core as well. So first things first, obviously you need to be sitting on your Swiss ball and make sure your feet aren't too close to the Swiss ball, because if you're too close, you're going to end up falling back. So make sure your feet are about a foot forward, wider than hip width apart. And then from here, just get a little bit comfy on the Swiss ball, have a little move around, make sure you're feeling balanced. Once you're feeling balanced, we're gonna start putting our hands on our belly and we're gonna do some deep belly breathing. So we're gonna inhale, trying to bring the belly button towards the spine, and then exhale through the mouth, expanding through the belly, and think about all that breath going down past the chest into the belly. And putting your hands there will just make it all the more easier. But also just think about shrinking your belly and expanding through your rib cage to exhale. So we'll do a few more breaths of that. Keeping nice and relaxed in the shoulders. Okay, great. Next up, I'm going to flip over to the side. You stay facing forward. This is just so it's easier for you to see what my pelvis is doing. So naturally through pregnancy and post-birth, you're going to feel more inclined to have more of an arch through the lower back, which is called lordosis. It's a completely normal thing to happen through pregnancy and postnatally too, because you've got quite a lot of forward weight through your belly. So naturally this is what the spine does, but it puts the pelvis in that posterior tilted position, so the pelvis is tilted back. So what we want to do now is think about engaging, zipping up through the pelvic floor. So imagine you've got a jacket internally and you're going to think about zipping up. So when we zip up, we're going to drive the hips forward. We're going to think about shortening the distance between the hips and the rib cage forward, not too much. We don't want to have a arched lower back. We want to sit tall and think tucking under, and this will feel a little bit of activation through the lower core here, which is exactly what we want. And then relax. So tilt through and relax, and really think about that breathing too. So inhale, suck in, tilt forward, exhale, expand the belly, relax. Really think about squeezing here in the lower abdomen and relax. 4 more of those. And we want to try and avoid the hips doing all the movement here. Try and keep it really core dominant. Perfect. Have a little relax. Next up, we're going to do some circles through the pelvis. So especially if you are struggling with hip pain at this point of your pregnancy, especially through the 2nd and 3rd trimesters, then this will feel perfect for you. But equally, you can get pelvic pain at any point of your pregnancy. So what we're going to do first things first is we're going to do some circles. So think about circling towards the left side of your body. Keep your hands on your hips and just think about working through, pushing the hips back to the side, to the front. Like you're doing like a really slow motion hula hoop. And just really think about where your core's working Think about working through your bum muscles too, through the glutes. Two more going this way. And then we're going to rotate it round, so same thing on the other side. And it's actually quite normal to find one side like cognitively, but also just strength-wise to work through the muscles and really feel the mind-body connection. There's always one side that will feel a little bit stronger than the other, so rest assured that is normal. And I just would like to remind you at this point too, if there's any points of these exercises where you feel any pain in your belly, it feels too uncomfortable, you shouldn't be pushing through that. So if you do feel discomfort, then just drop me a message privately or just note it in your next one-on-one check-in, and I can talk through it with you, and we can always sub out some movements if it's needed. Okay, perfect. Right, next up we want to stretch through the lower back a little bit. So I'm going to put myself forward again. Hello. Right, so you're going to bring your arms up above you. And again, if you feel dizzy or lightheaded doing this, or this feels too much in terms of balance, that's completely fine. You can always do this with your hands on your hips too, but coming up just really helps you stretch up through the spine, and you're just going to shift over to one side. And the stretch you should feel is down the side here, but also in the base of your back on your side that is being stretched. So just keep pushing, keep pushing. Again, shouldn't be pushing through pain, but a stretch. And slowly roll the ball back to the center. Give your arms a little shake, and then come up again. Sit tall, stretch over. So keep holding that. If you're doing this on your hips, it's the same thing. Just sit as tall as possible and stretch over. Just shift your weight towards the side you're stretching. And just try and keep really control with your breaths too. Okay, great. So next up, you're going to come off of your Swiss ball. You're going to come down to your all fours, and this is one of my favorite stretches, and I'm not even with child, so it's going to feel incredible for you. You're going to place the Swiss ball down. You're going to put your hands on the Swiss ball. You're going to bring your heels together like so. Roll the ball forward, bum back to the heels, and just rest your head on the Swiss ball. Really elongate your arms and just let everything drop through. If you can sit back onto those feet, that would be ideal. But again, just focus on that nice belly breathing. And you can slowly come out of that by just rolling your arms further towards you. Bring yourself back up to a kneeling position. And that concludes the pelvic floor / core / little stretch warm up. You can use it as a cool down too, or just a daily routine that you incorporate into your pre and postnatal life. I hope you found this helpful.